Right. Hi, everyone. I hope you can. Oh, there we go. Got a few people in. Hi, everyone. I hope you can kind of hear me. Thanks very much for kind of logging in this evening. This is a little bit of an experiment for us. We quite often do a fair few client evenings, but we decided to see if it'd be a little bit easier to stick stuff online for people. So bear with me. I've tried to set all this up. I've tried to run on a practice run, keeping my fingers crossed that it does all go well. But if you've got any problems, can't hear me or anything like that, there is a chat box down the bottom. Just log in, send me a message, and then fingers crossed I can get stuff sorted as we kind of go. So we've got a whole load of people that sort of like logging in now. So what I'm going to do, get rid of my ugly mug for a while, and I'm just going to share this with you, and we'll make a start. So once again, I was actually out on a yard several months ago speaking to a couple of clients to see what kind of stuff people wanted to basically. Oh, hang on a minute. We've got someone going. Hopefully, they're not going that they can't do anything. Cool. Hopefully, yeah, everyone can hear me. Cool. So, yeah, this client said that they'd really like to know a little bit of stuff on the basis of what to actually look for before going out and purchasing a horse. Someone said to me today, it's a bit unfortunate. It's kind of like closing the door after the horse is bolted to put on a talk like this. But again, people are always after horses. So I thought I'd do it on the basis of keeping it really basic and what I was actually looking for. If I was going to basically go out and vet a horse for myself or my daughters or a friend before I got someone else to do the official kind of vetting for me. So, right. So what I'm going to do is we're going to move on. I'd like to punch up one disclaimer. This is my own professional opinion. Over 20 years of practice, almost 20 years of practice, I've never seen the perfect horse that's always described in the textbooks. I've seen stuff close to it. I've seen some stuff out there which is wildly off the record, and you just think, crikey, how on earth can that thing remain sound? Because it's got some weird feet or a weird back, and they do their job. So just remember, whenever you're kind of going out and looking at horses, that it is just purely what that horse is actually used for. So we do vettings for purpose rather than purchase. So just bear that one in mind. But again, I've never seen absolute perfection out there. So here we go. First of all, I see Ben's already logged online anyway. Thank you very much for Ben here. He was kind enough to stand there and let me video his horse for a while. And basically, I'm going to go through this horse step by step, what I'd kind of look for if I was kind of going out and thinking, right, do I need to purchase this thing? So essentially, what I'm going to do, this should take about 45 minutes or so to go through, but this is what I'm going to go through. Oh, well, let's go back one. Sorry, just come in one. Sorry, lots of little buttons to press. One more. So I'm going to go through doing your homework and what to actually do actually before going and seeing anything. Go through balance and proportions, conformation, symmetry, lumps and bumps, which I've kept purely to legs at the moment, because everyone kind of sends me lots of pictures and all sorts. Is this bump anything to worry about? Where to look on fetlocks, where to look on hocks, and all things like that. I'm going to go through feet separately because it's one of those old adages of no foot, no horse. So we're going to go through all of that, go through something on eyes, lumps and bumps to look for on those, also breeds as well. Go through skin, some of the obvious things that we're always going to look for. And then I'm going to touch on dynamics and obviously motion and everything right at the end. So once again, thank you very much, Ben. You'll be happy to know that it's not an absolute disaster at all. In fact, if anything, conformationally, we are pretty good. So I'm going to start off right. This is a real quick one. I can't emphasize enough that all of this stuff is a general rule of thumb. So do your homework, trawl that internet. I put in this one, beware of extremes. Everyone has seen the £500 absolute bomb-proof horse that's advertised online. Normally they're 500 quid for a reason. Don't get me wrong. There are some absolute bargains out there. Some people get really lucky and you find a horse that's been advertised and it's for genuine reasons that they need to sell that horse on quite quickly. Doing your research as well and looking for gaps in that history. Everyone knows you can hop onto BSJA, FEI, BHA, British Special BD, look at the records for those horses nice and quickly, and you can make sure that there isn't any gaps. And that gaps are there for a reason. Normally, a horse has been out of work, has either had a breakdown, a tendon breakdown, something's going on. So be very aware of those. Considering your breeds as well. Now, this is again a general rule of thumb, but we do get quite a few people that are lucky enough to find an ex thoroughbred or an ex racer, which has a fantastic temperament. Normally, obviously, remember most of those horses have genuinely come off the track because they haven't obviously been good enough for the job that they were required to. But essentially, you're buying almost like a bit of a racing car, and that you're buying something at the top end of the spectrum. They come with their own problems as well. I did see one client today that was lucky enough to have found an ex-racer, an ex-thoroughbred, which is absolutely perfect. It has the perfect temperament and ideal for them. So they are out there, definitely. But again, considering your breed. So let's get on to the most important bit. So, right then, is a horse balanced? When everyone looks at a horse, there are various proportions and everything that you can look at. So I'm going to go through these one by one. So back versus abdominal length. Now, this is quite an important one. So back length is done from the back part of the wither, or the almost like the highest point of the wither, to the coupling part within the lumbar area. So just behind where your saddle would actually go to, and before it comes into the pelvis. That's your actual back length. Your abdominal length should always be longer than that. You'll be surprised that a lot of these horses, particularly again, if you're looking for a horse to actually breed from, you want something that's quite long in the back and everything can be able to hold it. But again, you've got to remember conformational changes like that will be passed on to progeny as well. So when we come through onto another one, this is, I always look at this bit. So if I've got my central square within a horse, I start to look at shoulder angle compared to hindquarter angle. So the shoulder angle most people know about, but actually you should have a degree of symmetry running from the point of the buttock all the way up to the coupling part on the back. Those two angles should be pretty similar within themselves. I'm going to go more into the angling of these in a while, but you want that symmetry between the two. And again, you should have a straight line from the point of the shoulder all the way to the point of the buttock. The main reason why we look at a lot of these things is it means that they're going to be balanced and proportionated between the thorax and the abdomen as well. And that's quite important when you're looking for horses where you want a deep area, plenty of lung capacity. You don't want these that are excessively long in the back and short within the thorax. So shoulder length to neck length. This is another one, actually. I'm just going to move a little window out of the way so I can actually see what I'm seeing as well. So with this one, that's I'm going to move my cursor here. So this shoulder length here, from the point of the shoulder up to almost like the point of the wither, should be almost the length of the neck. You see with this horse, it's just slightly longer. We've obviously got a little bit further up here, but I would anticipate that this length here to this length here are almost the same. Again, it's just with regards to balancing, because you've got to remember this thing up here, the whole head, can weigh anything 25, 30 plus kilos. It's a pivot. The longer this thing is, the more your horse is going to be actually going down the hill. So we need to make sure that these areas are balanced as well. Let's come back into here. Then coming on to wither height compared to hip height. So with a height here, everyone knows if you've got a horse that's croup high, that is young and is growing rapidly on the back here, obviously most horses, what you want them to be is almost level between hip and wither. You don't want these horses that are actually built downhill. You're going to find that incredibly hard then, particularly if you want a dressage horse or anything that you need to get its backside underneath of it, to actually engage that horse if it is very croup high or hip high. So again, looking to see you've got fairly good symmetry and all sorts along the back. Chest depth to abdominal depth. Again, there should be a difference between the two. So abdominal depth here, obviously from the back all the way down to the base of the abdomen, which is just in front of the stifle to measure it from, and then chest length from the wither all the way down to the actual side of the sternum. And again, these should be different. Obviously, your chest depth should be much, much deeper than your abdominal depth. You've got to remember, this is the area where you're going to get all of that lung capacity in there. This is smaller and this is bigger. There's a lot of weight for this thing to carry. So again, it's just making sure that those general rules of thumbs are done. So proportions, shoulder angle. This is an absolute biggie for me. Um, there's a lot of crossover between shoulder angle and pastern angles that I kind of look for, mainly because I want to always guarantee weight distribution. If I know weight distribution is even and central, then I know I'm going to be less likely to get issues within the limb. So when we're looking at shoulder angle here, we're running it right the way up the side of, you can normally feel the scapular spine as it runs up through here. So it should be tapping into the front of the shoulder joint and coming up to mid-wither. So this angle here should be around about 45 degrees. So when we're going back to neck ratios, the full length of the neck here compared to the underside of the neck, again, should almost be 2 to 1. So the downside to this one is if you get horses that are an incredibly long necked and everything, trying to muscle up that top of the neck is going to get incredibly difficult. And it also puts pressure on the nuchal ligament as well. So again, remembering this is like a pendulum and a pivot and everything. So the longer this length is, the harder it is going to be to keep this balanced all the way through. Throat and head length. So again, another sort of almost like half of the throat length and everything going to half of the head length. Again, these are rough rules of thumb. But again, if you get ones that are much narrower, this area in the throat is not going to allow airflow to come through. We need this to stay nice and open. So you do want plenty of room through here. Again, it's one that you don't probably think of quite as much. It's more again down to the basis of what you're actually thinking that horse is going to do long term. So hip and back length. So from the point of the hip or the tubercoxy running up to the tuberisco, which is the back point of the hip, actually should almost be equilateral to the end of the wither. So right the way at the back of the wither when you start to come flat in the back up to the coupling point in the back as well. So if this is exceptionally long, you'll find you'll get weakness and everything all within this area in that lumbar region. Again, making it really hard to get a horse to engage and propel itself. So that's with proportions. So I'm running through it quite quick. There's plenty to get through. So conformation. So again, nothing is perfect. I've never seen anything spot on to any of the textbooks, but we try to keep it as close to perfection to make sure that everything is symmetrical. And again, it's all about weight distribution. So if you have abnormal conformation or abnormal distribution of weight, you get increased amounts of concussion on areas that it shouldn't be, and you'll get increased amounts of stress applied to both joints and soft tissues. That's going to result in issues, long and short of it. Whether that happens in the short term or the long term depends on the degree of conformational abnormality. But we'll start with the forelimb. So this is a nice, again, the Lake Forest anatomical models are great. I've image source these and everything. They're good little images to have and to bear in mind. So this 90 degree that we see here is actually almost perfect in this horse. So we've got the shoulder length and the pastern length both at about 45 degrees, which results in two 90-degree angles that connect the two. But again, that 45-degree should shunt all the way through the center of the actual scapula itself. So you feel that scapular spine running through here. It's a visual reference. If this happens, that means that the center of gravity and the weight that is actually distributed through that, if you draw a central line all the way down from the midpoint of the scapula, it should run through the center of the elbow and then through the center of the knee, center of the fetlock, and sit just behind and everything, the central point within the actual pastern. This means, again, weight distribution down the limb is going to be as even as possible. So what I'm going to do, we're going to go forwards. I'm going to look at it from a cranial aspect, so from the front. So from this point, again, I think the important thing with these is that you want lines running through the center of the shoulder, center of the elbow, center of the knee, center of the fetlock. Now, you can see with this horse that we are just off center and everything. We're just slightly to the inside. Now, the one thing that I will say is never forget their horse's age. Some of these young horses, as they're growing through the rest of their chest and opening up, these two sections will obviously come out and you'll find that they will fall in line. Some conformational abnormalities will actually result in deviations from the knee. So we have what's called a carpal valgus or a carpal varus. So a carpal valgus is essentially when the the main part of the cannon bone comes out and it deviates to the outside of the limb. A carpal varus, it deviates to the inside of the limb. Now, any deviation, and I'm going to come on to the knee in a moment, any deviation from this puts abnormal stress on individual areas down the limb. It puts abnormal stress on a lot of the soft tissues and all the joints. So when you're looking at buying a horse, you're trying to think about longevity. And that's so, again, picking these kind of perfect kind of conformational areas is something that you need to be quite hot on when you're looking at them. So we're going to go in at the knee and have a little look. So again, with a lot of these, we've already drawn these lines as they come down. Essentially, we should be coming through the center of these knees. Now, the important thing that I say whenever you're looking at any of these is basically getting a horse square. If a horse is not square, you can't really assess its conformation properly. I spend most of my time, frustratingly, trying to get horses to stand as square as possible. The squarer they are, then you can assess the limbs. And here we go, make sure it's square. So again, as we've got here, most people know about knocking knees and bow legs, essentially where you've got deviations that come out from the knee or deviations that come in from the knee. But again, as we drop it down, we should be coming through the center of the elbow, center of the knee, through the center of the actual fetlock itself, and just sitting just behind this center here. This way, if you actually drop a plumb line down the front where some of the weight distributes, it will actually sit within the middle of what we call P2, or the middle of the pastern joints, which I'm going to come on to when we go through feet. The hind limb. The hind limb gets a little bit more almost scary sometimes when you first look at it, because again, it's all about weight distribution. Now, the vast majority of that weight is going to be all propulsive. So this is the bit that you really need to pay attention to. Now, everyone knows about the so-called kind of jumper's bum, where we're looking for almost like a perfect triangle here from the point of the hip down to above the stifle or next to the stifle fold, and then back up to the tuberisco or the back of the pelvis. The closer it is to a triangle, at least you're going to get symmetry through the top end of the wing of the ilium, so the wing of the pelvis, and coming through the femur, and even distribution into the stifle and then running down. So when you're dropping a plumb line with these ones, you're dropping it almost just slightly off center, or not too far off center from that triangle. And that then should follow itself all the way down, and essentially it should be tapping into the front part of the foot as it does here. Now with this one, at least then you're going to get an even weight distribution, because everyone forgets about the hip joint itself, or the coxofemoral joint, which is in here. Most people think it's either here or right up here. It isn't. It's right in the center of it, and it's pretty deep. Hip problems are like chicken's teeth. They don't occur very often in horses, but again, it's where the point of all the weight is actually distributed. So it's also important to think about what's running through down the back of the limb. Now, some horses, in an ideal world, again, you'd love the back of the hock just to taper on this plumb line coming down from the point of the hip, and you'd love it to come down into the point of the fetlock, or the back part of the fetlock. This horse is just slightly under itself. Again, nothing is perfect at all. They find that the further they come underneath themselves and everything, the more problems it does cause. And what I've got is some diagrams coming up showing where the pressure points then will actually be related to a lot of them. From a symmetry from behind, this horse is pretty damn spot on. Luckily, again, we stood reasonably square, making sure they're as square as possible, but you want them to go from the point of the buttock all the way down through the hock, through the middle of the fetlock, and bang through the center of the foot. So again, looking at them from behind. So, gone through this a little bit, but what I did do, again, these anatomical models are absolutely brilliant and everything. And what I've done is I've stripped this down into the foot and the rest of the pastern and the fetlock a little bit more as we kind of go on. But anything that stretches out underneath or behind, so either sickle hocked or standing out behind them, will cause areas of stress. Invariably, 9 times out of 10, the hock takes most of that brunt. And as we all know, hocks are one of those really common kind of joints that have issues in them. You spend your forever just kind of either medicating them or trying to stay on top of them. So trying to make sure weight is evenly distributed through the hock is absolutely essential. So I'm going to skip through this quite quickly and then come on to symmetry. So once you've gone through the conformation, particularly on the hind limb, you've got to look at the muscles. I spend a lot of time trying to get horses to stand square because I'm trying to assess these muscle groups. So we start with the gluteals. Everyone thinks these gluteals stretch all the way around here. Well, they don't. There's a whole load of other muscles that sit in this area that actually aid the whole of the hind limb. So gluteal symmetry is important. You often quite get dips here that are underneath. And I've got some images soon where you'll actually see dips underneath the top of the gluteal as well. The semimembranosus and semitendinosus. Now, this is a set of muscles that run over the back of the pelvis, over the tuber ischii. They attach right in underneath the gluteals and they stretch all the way down. And some of these extend even further down as well. But you want to look at this symmetry. So if you see these bulges here, it's making sure that both of these bulges on both sides as they run down into the hams and all sorts are nice and symmetrical. The biceps femoris is one of the larger muscles in this area, and when you look at it from the side, it covers an immense area, and there are various proportions or bits to the biceps femoris, but it fills this whole area in here. The reason why I've done it on one side and not done it on the other is that I'm looking normally at this area here. So if I'm seeing asymmetry between here and here, or here and here, or on the semimembranous tendinosis, muscle asymmetry occurs when there's been a problem for a while. It doesn't happen overnight. It's unlikely to happen significantly over a week or two, but you're looking at months. So if I'm going out and looking at a horse and seeing that it's got reduction on one side of its gluteal here, it's built up on its gracilis on the inside of its thigh, I know that this horse has been asymmetric for months. Why has it been asymmetric? Is it either being ridden asymmetrically, or does it have an ongoing problem that actually results into it having that muscle asymmetry? Inner thighs. Again, this is another massive one. The gracilis muscle that sits here is absolutely huge. So look at these inner thighs. Move the tail to one side. Make sure they're square. Look at the inner thigh and then compare. Normally, you'll find you'll get a change in the gluteal and the gracilis in opposite sides. So always compare left to right all the time. And you should see relatively normal symmetry. And in here again, we've got pretty good symmetry on both gracilis muscles. Going over to the front end, I actually saw a horse today where there was an asymmetry here that did actually correlate to one of the lame limbs that we were looking at. But look at the forelimb by actually standing right in front of a horse rather than behind it. So the shoulder, so there's a whole load of muscles that are connected with the shoulder, not only the trapezius, the infraspinatus, and the supraspinatus. All of these muscles are all going to be in this kind of area and over the top of the withers. But if you're standing in front of a horse and looking directly to them, I saw one today that was even over here but had a dip right the way in the front of the shoulder. And actually, this was one of the limbs that was actually lame. So when you're looking at that, you're saying, okay, is that due to injury? Is that due to ongoing pathology? Is there something else going on in there? So before even sort of seeing the move, when you're looking at muscle symmetry, you get a good idea of whether you're actually going to get a problem on a limb or one limb to particularly focus on when you're seeing it move. The pectorals are another thing. Obviously, if you've got any areas where these are all gone down, Pectorals develop themselves quite well, to be honest, and you don't see huge amounts of asymmetry on these ones. But do remember again, if you've got a young horse that's quite base narrow and narrow through the chest and just widening, not to see large muscles here is not unusual, again, considering age. Right. So I'm very aware that time's cranking on quite quickly, and I only kind of set this up for around about sort of an hour. So we're about halfway through anyway. So one thing I want to say is not everything is naturally a problem. Just because something is asymmetric doesn't always mean that you got an issue there. And this is a little video of a horse on one of the yards that we went to. And you can see you've got asymmetry here to the top of the tubercoxae, but you've also got asymmetry here to the gluteal musculature. And when you look here, if you look at this semimembranosus here, this is the bulge, look at it on this side, much, much larger. And again, looking at the asymmetry here with regards to this gluteal musculature, unfortunately, I didn't pick up the tail, but you can see here, this line here and this line here aren't symmetric. And this biceps femoris here, compared to here, is much, much larger on this side. So although this horse actually does the work that is required to by the owner, you could always say, well, actually, it's like going down to a gym. If you're using an arm or a limb or something more and you're putting more and more work into it, it's going to build muscle up. So you actually say in this horse, well, actually, this limb is probably working a lot harder than this one. Now, is that because you have the asymmetry here at the top of the pelvis, and is there an underlying issue? Or has the horse been trained like this for a significant amount of time, months, if not years, and it's just developed this kind of one side? It's like being left and right-handed. I'm going to move back onto this one. This is one's a little bit more subtle and everything, but there is an asymmetry here compared to the top of the gluteals on the right hind compared to the top of the gluteals on the left. And again, I'm looking at this semimembranosus. I'm going to be looking at this biceps femoris. Again, we're slightly built up here. So we have this asymmetry or this contralateral asymmetry that's going through. But again, not always does this mean that there is a problem. So bear that one in mind. Right. So that's through symmetry and kind of conformation. I'm going to go on to lumps and bumps. So I'm going to start off with fetlocks and tendon sheaths. I'll quite often get images and pictures sent to me where we do have lumps like this, and people are like, is this an issue? Well, it's always hard if you're not there. And if it's associated with lameness, I would always consider it an issue. But there are some areas what are normal and some areas what are abnormal. So I want to overemphasize symmetry is always key. Always compare one limb to another. So left to right, front to back. I'm going to go through this first. So this is our horse again that we've just got up, thanks to Ben. So this is the fetlock joint here. Now, it's a large area, but the reason why I've done this is everyone can palpate that taut band, which is here. Now, this is one of the branches of the suspensory ligament. So this will be the lateral branch of the suspensory ligament that sits on the side. Behind here, there's a bone called one of the sesamoid bones or the proximal sesamoid where this ligament attaches to. Just in front of that, there is a small depression. That's the fetlock joint itself. And you can see here in this little diagram, as you push your thumb down, you shouldn't really get any kind of sort of lump or soft squishy mass in this area. If it's in front of that line, it's in the fetlock joint. If it's behind that line, it's within the tendon sheath. Now, the tendon sheath extends all the way up here, beyond the fetlock, comes through the fetlock canal and extends all the way down to the pastern. So when you're looking at fetlock sheaths here, again, this is the fetlock sheath. So this yellow dot here corresponds to this white dot up here. And as I've got the red dot here, corresponds to the back of the pastern. But this is the full length of the tendon sheath. Now, it's always much easier in the summer and it's much easier in thoroughbreds. You get something with a long feather on it and it's really difficult to spot. But you can see this notch. So this notch on the back of the fetlock is a bit of a telltale sign of a couple of things. Horses should not really have this notch. If they have this notch here, normally you find it's because of one of two reasons. You've either got overall distension of the tendon sheath, and you can see here, you've got a bulge here, and you can guarantee the back of this fetlock, if you stick your thumb into that, you should essentially just feel practically bone, and it should feel really pretty flat and not squishy. You can pretty much guarantee if you stuck your thumb on that, it'd feel like you're putting your thumb onto a balloon, or there'd be something squishy underneath the skin. It's because the extension of the tendon sheath above and below the fetlock. Now, the notch is because of the annular ligament. The annular ligament is a ligament that straps all the way around here, keeps the fetlock joint completely enclosed. It pulls the sesamoids into the back of the fetlock, into the fetlock joint, and stabilizes it. The reason why that notch is there is because this goes tight. So as the tendon sheath distends top and bottom, and you get that increasing visual notch there, this ligament, it's like putting a tourniquet around a balloon and everything. It becomes tight, and over time, this ligament will thicken up. Now, if I see that notch in the back of a thoroughbred leg, it'd give me telltale signs that this has been going on for a while, and the chances are this thing has annular ligament constriction. So I would be paying particular attention to this limb to make sure that there was no lameness. I'd be personally flexing it up at a vetting, but even when you're not flexing horses, because I wouldn't kind of recommend everyone to go around just yanking horses' joints around, but when you trot it up, keep an eye on that limb. If you see something that looks a little bit off, that notch is your big giveaway that you've probably got annular ligament constriction in it. So again, look for the indentation. Check your pasterns. Anything puffy, you should never have anything puffy or outpouching on the back of that pastern. And if it's associated with any kind of lameness, obviously that's a big issue. So hocks, this is kind of one of those that I genuinely think is important for everyone to know. I'm just going to make sure that everyone still can kind of hear me and all sorts. Everyone's still good. Everyone's quiet in the chat, and I haven't heard anything yet. So I'm kind of hoping everyone can still hear us. So with the hock again, symmetry is absolute key. Always compare again the opposite limb. And what I'm going to do is we're going to go through where to exactly look and what structures are involved with each one. So I have 6 places that I actually look for in a hock. So we'll start off right up this top one. So right at this top one, essentially, as this group of tendons that comes down here and it forms like your Achilles tendon and attaches to the end of the point of the hock, there's a sheath that runs in here. Now, this tarsal sheath here is designed to protect all these tendons as they actually come over the point of the hock. The thing is that sometimes you do get puffiness around here. Now, quite often there's lots of what we call retinaculi. So these are tissue bands that sit over this area that keep the tendon sheath and the tendon all together. So if you're seeing something looks corrugated in this area, you shouldn't really be having any kind of puffiness in here at all. Now again, this tendon sheath is present on both the inside and the outside of the limb. So you really need to look at both sides to make sure they're symmetrical. So nothing here. This one, what everyone knows as a capped hock. The capped hock is thanks to a bursa that sits, or a bursa is just a sheath that protects again the tendon as it goes over a bony prominence. It protects this tendon as it comes over here. Capped hocks here are normally because you get fluid which accumulates in that. Now, again, a horse can cope incredibly well with a normal capped hock, and it's not an issue. If you do have capped hocks in here, look for wounds, and when you see your horse move, check that when it walks away from you, that the attachment of the tendon that sits onto the tip of the hock here doesn't move, or what we call luxate, from one side to the other, particularly to the outside. So anything over here again is irregular. Now, Curbs as we come down here. These are a little bit harder to feel, and again, these are normally because of one of the tendons that run, the ligaments that run over here, where you're getting excessive fluid that's sitting within it. It's overstrained. Again, anything with additional fluid in is an indicator that you've had straining in that area and is going to cause you an issue. Curbs themselves, you used to see these quite a lot. People are getting quite hot on these now. I don't see quite as many of them because, yeah, people just don't buy horses that have massive outpouching here. These are the two that kind of catch people out, where you're looking for either what we call a tarsoceural joint effusion or a thorapin. So you can, this one is the joint that sits here within the hock. So there are four rows that's sitting here to the hock: the tarsometatarsal joint, the distal intertarsal, the proximal metatarsal, and the tarsoceural joint that both sit in here. This one extends and moves to this one. So you can get outpouching here of fluid. So if you push your thumb into this bit, what you shouldn't do is you shouldn't get a distension out the front of the joint. If you do, 9 times out of 10, it means that it's in the tarsoceural joint itself. So you can push the front of the joint and it outpouches here. You push here and then it outpouches at the front of the joint. I'd be particularly wary if I was looking at a youngster under the age of 6, and if I saw any kind of outpouching here or on the front of the hock. The main reason is that various conditions. One of the biggest ones is OCD, or osteochondrosis dissecans, which you find in young animals, particularly as they're reaching skeletal maturity, where you will get extra effusions or fluid buildup within the hock joint, and pressing here, it will outpouch to the front. This one, or the thorapin, normally doesn't cause that much of an issue. Again, it's the tarsal sheath, or it's the distension of the tarsal sheath itself. Conventionally, they're a bit like a golf ball. They sit either side, so you can get what we call, or old-fashioned called, genuine thorapins or false thorapins. I think with a lot of these ones, I'm not as worried about these, particularly if they're not associated with lameness. If you stick your thumb in this and it pops through on the other side, they're more kind of false thorapins. You've just got something coming in and out of the tarsal sheath. And again, if you don't have any other distensions in any of the areas and you've just got it here, it's more aesthetically unpleasing than actually being a functional problem. So they're the 6 places that I would look for. And again, looking to find out whether whatever it is squishy or whether it's hard. Anything that is hard, essentially, you've got fluid that's been built up to a point of where you've got excessive pressure within a tendon sheath. That's a real issue, and that's likely to cause lameness. So, and again, have you got any pain or lameness? But again, remembering lumps and bumps may not be an issue. They're just an indicator that there may have been excessive strain or abnormal wear due to concussion or balance or something like that. So again, just bear it all in mind. I think this is probably one of the most important parts of whenever you look for any horses and everything. Oh, just 1 minute. No foot, no horse; no teeth, no horse. Yeah, something that everyone needs to completely bear in mind. So let's go on with these one. So let's start off with balance, and then we're going to go through symmetry and wear, shod versus unshod as well. So where do I start? So when we look at feet, again, thank you very much, Ben, for this one. Remember at first, front feet and back feet differ greatly. Front feet, I think, are more important to assess than back feet. Again, a lot of horses are unshod behind. That's not an issue, but a lot of weight is borne through those front feet. So making sure that you have symmetry and everything in these will save you an absolute fortune. I wish we all had X-ray vision. What we're trying to do is we're trying to make sure that the weight is evenly distributed through the foot and through the bones. Once they're distributed well through the bones, the soft tissue structures then will bear all the weight that they need to. So I'm just going to mention a couple of things. Now, the side to side, or what we call a lateral medial balance. So the lateral is just outside, medial is inside. So whenever you hear us talking lateral medial or whatever, we're only talking about the inside and outside. The front to back, either craniocaudal, some people call it dorsal. So this can also be called a dorsal or a front side or a rostral side and a caudal side here. So coronary bands, wall angles, wall height, and toe clips. So go through at first. Here, coronary band. Your coronary band should be even and flat and horizontal to the base of the foot. It's really important. If you get any sloping to this, again, sloping normally means you've got compression. If you've got compression, you've got uneven weight distribution. Uneven weight distribution will mean something has to give at some point, and they're likely to cause you issues. So look for a straightness sitting all the way through your coronary band. When we're looking at wall angle, we're looking here. So the medial and lateral sides of the wall should be as even as possible. So there should be no asymmetry to these two walls. Again, what you can do is you can actually draw a line up. You could measure these angles, and a lot of farriers do look at these angles as well, and you can look at these in more details, but I wanted to give a general rule of thumb at first. A lot of people do see where you get an excessive amount of angulation here, which results in increased length. As that happens, the foot will start to flare out. If the foot starts to flare, again, abnormal weight distribution. When you're looking at horses as well, whether they've got a toe or a quarter clip, it's a classical kind of giveaway. Farriers utilize different shoes in different ways to try and maintain balance. Mostly, and if at all possible, we like to keep horses in a toe clip in front and then quarter clips behind. The main reason why you'd ever use a quarter clip is normally to shunt the shoe backwards. Now, shunting the shoe backwards, you're trying to create support in the heel. Now, you can't do that if you've got a toe clip. You can if you extend the shoe back, but the downside to doing that bit is normally you end up with so much length out the back. If you've got a horse that forges, it will just pull the bloody shoe off and it will make an absolute mess. So instantly, if you look at a horse's foot and you're going to buy it or consider buying it, and it's got quarter clips on in front, you need to look at its feet really carefully. Why has it got quarter clips on? Has it got pads on underneath? What else has it got going on? I'm going to go through feet in a little bit more detail, but by putting a quarter clip on them, dragging it back, it normally means that horses quite often have what we call caudal foot pain or pain in the heel. These ones, again, are susceptible to things like navicular syndrome, impar ligament desmitis cases, side bone, all things like that. So there are various conditions that we see as soon as you start to see that shoe being pulled back, or a farrier is doing it, try to correct the balance until they can get it back into a regular shoe. Now again, sorry, I just managed to move a window out that I can't see. There we go. So going on to the front to back or the craniocaudal, we're looking again at dorsal wall, so this front wall, heel height, and cracks, sand cracks and grass cracks. I don't really mind what people call them. If you've got a crack in the hoof wall, it's there for a reason. It's either through poor balance, poor farriery, being completely unshod, or you've got a weak hoof wall. So, and then I'm going to go spend a little bit more time talking about hoof pastern axis because this is an absolute biggie. But so you remember this kind of 45-degree line that we have going through the whole of the pastern and the foot. Again, 45 degrees here, and this should be symmetrical to the top of the shoulder angle itself. When you draw that 45-degree line, it should be coming through the middle of the pastern, through the middle of the foot, and then you should be able to draw two parallel lines between the back of the heel and the front of the foot. This is a pretty well balanced foot from a craniocaudal kind of aspect when you're looking at this. This is kind of like what, in an ideal world, all horses would have feet looking like this. You're going to get an even weight distribution. And again, I've put, if only we all had X-ray vision. just as an adjunct, getting things like balance x-rays and all sorts I think are a brilliant little thing to do if you're starting off buying horses, to have a set of balance x-rays to know what the internal structures are looking like. Sometimes, and it was a recent reminder to myself, sometimes you get a horse that has an unbelievably asymmetric hoof capsule, and you're thinking, crikey, that looks like a disaster. The bones inside must be all over the place and malaligned and unbalanced. Not necessarily. We'd love to have x-rays of every single horse before we purchase things, but obviously we can't. But to get those balance x-rays gives you a good idea of how the foot capsule is actually interrelated to the bones going on inside. So what I'm going to do is come on to hoof pastern axis. So looking at the dorsal and then looking at the side views. So everyone's seen these and everything where you toe in straight or you toe out. Now, these are extremes, but a lot of horses toe in, particularly when they're actually in dynamic flight. So some horses can stand reasonably well, but when they start moving, they will toe in quite rapidly. Now, the thing is, as soon as you get any asymmetry to any of these, I'm going to come on to this bit first, you get pressure points or areas of stress. So here, when you toe in, quite often with a toe in or a pigeon toe conformation, what you'll do is you'll get increased pressure on the outside, so the lateral aspect of the hoof wall. This will result in an upright hoof wall. Normally it results in a medial or a medial flare. What you'll often find is you'll start to get cracks in this wall because there's too much concussion. The problem is this has instantly put more pressure down the outside aspect of the limb, all the way through these joints, and it will ricochet all the way up through the middle of the pastern, the fetlock, through the knee, and all the way up to the shoulder. So once they are this toe in, now once you get an adult horse or you get it to skeletal maturity, you are not going to significantly change a conformational change like this. What you can do is we can, if you imagine putting a shoe here on the outside, we can actually create a false kind of wall to try and even up this symmetry. The key with a lot of these ones is to prevent excessive flare or wear that comes out through the inside of the limb. Having a good farrier and keeping an eye on both a horse that stands there statically and then runs dynamically, really, really important. Again, when they're toe out, you've got exactly the opposite. You've got all that pressure again on the inside. So you'll get a very upright inside wall, you'll get a flared outside wall. Same principle, you get all the concussion riding up the inside of the limb. When we start to get that asymmetry and everything between hoof length and everything, what you can do, if they are broken outwards, so in other words, this wall becomes shorter and everything on the outside, again, excessive concussion. And in a minute, I'm going to show you a picture of a hoof wall that's actually started to do a lot of this. So again, when you break them in and everything, you're going to get all of that concussion on the inside of the wall. And when you look at it from a lateral aspect, this is what I mean when we start to get what we call long HPAs or sloping hoof pastern axes. And that you get excessive amount of strain that sits on the back of the suspensory ligament, back of the fetlock, and it runs all the way through, and you get excessive amounts of weight applied to the back of the heel. This results in compression of the heel, compression of all the soft tissue structures in there as well. You have those upright, really kind of almost like Arab feet. And you've got to remember again, Arabs, warm bloods, they all have these short, boxy, stumpy, upright feet, but they will also have very contracted heels. It does predispose them to some conditions. It's not pathognomonic for it, but you do see it in a lot of them where you have these upright, stumpy feet. They get incredibly tight and everything as they come up. They trip a lot on here because basically the weight distribution has been shunted forwards. It's no longer sitting back here where it should be. As it puts forwards, the breakover point of the foot then means that this aspect of the foot comes into contact with the ground first. When it's in dynamic flight, it trips. So horses that are really trippy, or you see an excessive scuffing to the front of a shoe, that gives you the overall idea that you have this upright HPA. And again, you get this very similar kind of finding as we actually go through here. A broken back hoof pastern axis puts excessive amounts of pressure onto the front of the coffin joint, but then it squishes the heel down and it squishes it right down. When you have them broken forward from the pastern, you have again excessive pressure sitting on the front of the pedal bone, which will sit just about here, on the back of the fetlock. So there's a lot to look at. Hoof pastern axis is an absolute biggie. I spend a lot of time looking at horses' feet, and I think this is one of the biggest things to work with a farrier with. But when you're trying to spot this in a horse that you're thinking about purchasing, just never ever ignore it. So this is just a picture of a horse's foot that I took about 4 or 5 years ago. So I don't think anyone's going to recognize this one, but I'm going through this one. So I want to go through this foot and what do I see in this foot that has got a whole load of warning signs all over it. So look at the shape and any rings that you've got within the hoof lines here. So what am I seeing? So poor hoof pastern axis. So what I look for when I'm dropping a plumb line from the middle or the what we call the distal condyle of P2. So as the pastern comes down here, sitting right in the middle of the pastern, just above the coronary band, I want to drop a plumb line right down to the ground, and I want to see about 40% of the weight to the weight bearing surface, basically, behind that point, and about 60% in front of it. Now, this is no way near 60-40. This instantly tells me that this horse is going to have a lot of problems in the back of the heel. It's likely to have caudal foot pain, so pain in this area. You have your navicular bone that sits in here, your costochondral, or sort of your collateral ligaments and your costochondral ligaments that sit all in here. You have your impar ligament. You have all of the ligaments that run down here, the back of the pastern. So you have your straight and oblique sesamoidean ligaments. All of those will be under strain just because this heel is way too low and you don't have 40% of that hoof shunt behind this center of gravity. So again, low heel in here. Now, if you look here, you have an indentation in the heel. So this is the weight bearing surface here. So when you stick this foot upside down and you look at it, you can pretty much guarantee this is going to have a flat frog, a flat sole. Both of the bars on the foot are going to be compressed. And from that point of view, that horse is really going to be suffering quite a lot and it's going to struggle, particularly on uneven ground. So this horse needs to be shod. So what else have we got going on in this foot? We've got irregular hoof lines. Now, when you look at these hoof lines that run up and down the hoof wall here, you can see them. These should mirror the 45 degrees as it comes down. These are corresponding to the hoof tubules, basically, so hoof growth. You can see as we've got them, they're probably probably not far of 45 degrees here on the dorsal hoof wall, but as we come back, the lines essentially are extending this kind of direction. So they're becoming flatter and flatter. So in other words, the tubules or all the weight bearing structures within this capsule are under abnormal stress. And this is because of growth irregularities. You can see it here. The coronary band here is this is where all your growth is going. Now it takes about 9 to 12 months to grow from this point to this point. So this horse basically in the last 3 to 4 months has had significant changes going on within the hoof growth here, which has resulted in this bar that has basically come all the way down here, which is why you've got this double edging to the heel. You'll have all of this ended up being collapsed. In addition to that, you see these lines here. Now, I've got deviations in the hoof wall and I've listed it here. So because I know it's 9 to 12 months from here to here, about 6 months ago, this horse sustained quite a bit of a crack here that is extending all the way down the hoof wall. The problem is this is probably due to abnormal growth. Now, this will then leave it open to abscesses, splits, instability of the hoof wall, and there is the chances that this thing can split, and you see a split here, but you don't know how far this goes in. So again, you see any kind of cracks down here, you need to start to worry. And again, I've listed it here about a month ago again. It had deviations to the hoof wall. Now you should see small lines in these, but you should never see bands or bars that go all the way through. So I just by looking at this one hoof and taking one picture and just look, you know what that horse has gone through over the last potentially up to a year. So again, no foot, no horse. It's a general rule of thumb again, but they're telltale signs of whether you're going to land yourself into trouble or not. So always look underneath the foot. So I'm going to go through balance, symmetry, and looking again. This is really important. So if you've got a horse, I hate to go see horses when they've recently been shod. I like them to have been shod for at least a couple of weeks, 2 to 3 weeks preferably. Because if you've got any asymmetry to the foot or any asymmetry to the wear, the nail heads wear as well. So got a little video here. So running your hand down, and I'm going to come through and just pause this up a little bit. So as you pick this foot up, right, I'm going to stop here. So when you look at this, you basically want to see complete symmetry as you're coming around. Now, when you look at this, if you look here, you see this shoe. This shoe's been on for a while, but you have asymmetry here to the wear. So instantly look at the wear of the shoe. This one is slightly close onto the bars here, so we can't see any of the bars underneath. And as the foot sinks, this is likely to expand, or it should expand, because this is where the weight-bearing surface goes on the wool, the bars, and the frog. So because it's in a shoe, you won't get as much expansion, but if this expands too far, it's going to be pinching into the sides of the shoe itself. So here I'm looking at nail head wear. Sometimes you'll find on one side that you will have literally nothing left of a nail head. Then you know that that horse will land really hard onto that one side and asymmetrically. So you don't even need to see it move. You already know how it moves. This horse moves and it lands slightly to the inside. But when we looked at its conformation and we dropped a plumb line down from its shoulder through its knee and through its fetlock, we already knew that it standed slightly base narrow. So it's unsurprising, really, that we've got slightly more wear to the inside. Absolutely fine at the moment. It's not horrific by a long shot. So once you've done that and had a look at the wear, I then normally stick my thumb on the back of the heel and push it down. So you want to look straight down the wall here. So when you're looking at farrier again, we want symmetry here in the shoe, but also symmetry here on the heel as we're coming through. So these are fairly symmetrical. Both of these heads here look symmetrical, and looking at this wall, the outside wall and the inside wall, are they symmetrical? They're not too bad at all on this foot. But again, you need to look straight down the middle of the foot. And does the middle of that foot and the middle of the cleft of the frog hit straight down the center of the actual of the foot itself? I'm just going to reverse it a little bit, because when you think about it, the front of the pedal bone sits here. So everyone thinks the pedal bone sits in the back here. It doesn't. It sits here. So the tip of the pedal bone is normally corresponds to almost around the front or the apex of the frog. The center of balance is back here, which sits in the kind of back part of the coffin joint, because in here you also then have your navicular bone that sits here. So if we run this, I'd like to thank a client that I saw yesterday, that this horse is unshod. So when I pick this horse's foot up, you can see the difference. You've got this complete flaring out here to the lateral wall as it comes out, and you've got this flaring on this side. This horse does not land flat on the ground. The downside is because it's flared here, this flattens out. A horse should have what's called a bioconcave sole. It should sink in a little bit in order to alleviate any weight. So weight again should be on the frog, the bars, and the wall. If the wall is not symmetrical, it won't allow, it will put an abnormal weight on the bars and the frog, which will then flatten, and then the sole will flatten as well. Then it makes it harder for farriers over time to pull this back. So if you're looking at a horse with regards to purchase and you see this is going to take a while to pull it back. This horse would benefit from being in shoes for at least 4 to 5 cycles, because you're going to get back onto the balance in here. But when you're buying it, you already know you're going to have 6 months before you get this thing possibly into a better state and a better balance. So just looking at the underside of the foot, incredibly important. I'm going to rush through the rest of this pretty quickly because I'm literally cranking up to the hour already, and I've probably been harping on too long. If everyone wants me to shut up, please tell me. So, going general rules of the thumb for eyes, wall eyes, are these a problem? No. Okay, but you need to consider breed. Just because it's got a walleye and just because it's got unpigmented eyes doesn't necessarily mean it's an issue. I'd actually be more concerned about this. So this is the nictitating membrane or the third eyelid. From this point of view, this could potentially cause you an issue further on. And I pick this up and warn people about these in vettings. You don't want to see anything that looks like a cauliflower on this thing. Considering breed, this thing, the Appaloosa. So some breeds are incredibly susceptible to various conditions within the eyes. Uveitis is one of them. So uveitis is just inflammation of the soft tissue structures within the eye. We do know that there are breed dispositions to this thing. So if you're seeing a horse with a walleye that is an Appaloosa, that when you look at its eyelids should basically be almost parallel to the ground. They should never point down to the ground. If they point down to the ground, it's got a condition called ptosis, where normally it's quite painful on the eye. So if you see that and then you see discharge down or a watery discharge, this horse has a painful eye. So please be aware, breed plays an absolute biggie. But with regards to third eyelids, this thing. If you see this thing, this is a squamous cell carcinoma. So this is a tumor into the center of the nictitating membrane or third eyelid. Now you can actually remove these, but again, this means that you're going to have some small surgery done on your horse before you even buy it. So again, keeping a close eye, and normally it happens in unpigmented. Not always, but most of the time in unpigmented third eyelid. So if you see a third eyelid, I always warn owners, but again, pay particular attention. And again, looking for weeping or any discharges. Skin, the biggie, the absolute biggie for me. Looking in the armpits, in the thighs and groin, be really, really kind of critical in these areas. Now, this is a sarcoid. Now, when you see subtle hair coat changes and discolorations like this, it's much easier in the summer months and everything when you're looking at that summer coat. But if you see this on the inside thigh, bear in mind this is a sarcoid. Does a sarcoid stop me buying a horse? No. But it does tell me that I'm going to spend some money on this horse and everything. Sarcoids, if treated early, they're a type of skin cancer. Treat them early. You spot them, treat them when they're small like this. Get on top of them quick. Because again, looking right up in these areas and get in there close with a light as well. Use your camera phone or whatever. Just get in there and look in these areas. They're places to find subtle hair coat changes like this. Now, inner thighs. Inner thigh have several large veins that run all the way through it. These are absolute telltales and everything. The problem is with these inner thighs when they're associated with these vessels is they are really annoying to get on top of. These require a lot of topical treatments and they are going to cause you some expense. These will develop into further onto these are as we kind of come through the occult and into the verrucous sarcoid and everything. But again, it's the hair coat change associated with these stifle veins that run on the inside of the thigh. Then they start to become a little bit more lumpy bumpy. When you start to see, again, these little nodular ones that sit, again, associated with veins, always look around the veins, look for these little lumps, anything like that. Again, you're going to start to spend a little bit more money. Would it stop me? No, but it would make me cautious that if I see one, go over that horse with an absolute fine tooth comb. You start to see these ones like fibroblastic sarcoids, you're just not going to touch it with a barge pole. Understandably, these are going to take a lot of effort to get on top of. And then we come into these mixed forms. Again, don't kid yourself and everything. If you've got sarcoids, it has a type of skin cancer. It's going to take time to get on top of. Once they've had them, we don't understand the complete etiology from it, but the chances are that you will see recurrence of them at times, periodic times. There are queries and questions whether these are infectious, whether flies can go from one horse to another. You speak to Professor Nottenberg, who's the absolute guru on these. Jump on these as fast as you see them when they're at their smallest side. Again, you start to see stuff like this. Obviously, you're never going to buy any horse like that, but this is what they can actually turn into. But again, you see all these little small ones. These all started as those small verrucous and occult sarcoids. They shouldn't be left at all. But again, be really picky when looking for sarcoids. Melanomas. Okay, small melanomas like this, these are going to develop into something a lot bigger over time. Around the anus and the dock, you will see them around the throat and around the eyes as well. Now, we used to laser a lot of these off. Actually, now we do sharp dissection with these and laser the smaller ones. We need to be really aggressive with these. Would this stop me buying a horse? If you're buying a grey, expect that at some point there is a high chance that it may get a lump or a bump on it. Get on top of it quick. When they are around here, there are some new surgical techniques to actually bring out some really good clinical results. But again, it's going to cost you money. They will develop. They will definitely develop. We've all seen them where they become more and more nodular, particularly around the anus and all sorts. These are more problematic. I'm not going to, I can do a talk on melanomas and the surgical approaches to them if anyone wants one, but we can remove all of these now. I'm also going to say, looking around eyes, again, you've got horses that are with no pigment. There's Appaloosas, anything like that. Looking for changes around the eyes here and everything. These are melanomas and everything. You need to be careful with these ones. So I've managed to run through quite a bit. I've got to this bit. Now, I got to dynamics and I just wanted to show you a little video. Now, this is quite often the stuff that I found this on the internet, so it's a generic one, but this is the kind of stuff that I get sent regularly where is this horse sound? Should I buy it? It's a difficult one and everything. You can't assess a horse properly. You get a good idea when they're trotting up and down like this, but it's incredibly hard when you see videos like this. And I've got some videos on my phone where basically I only see their feet. I don't see anything else. But trying to assess a horse with regards to lameness and everything is really hard through videos alone. So I thought I'd do an hour on basically what I look for statically within a horse and everything before I went to purchase it. And then give everyone the option that if you want me to do a webinar, because we have gone over our hour now, if you wanted me to do a webinar on assessing lameness with regards to a horse and everything and what you can do and how we can sometimes potentially help you out on that, let me know in the chat or email us or message us or anything like that. And basically I can carry on doing a longer webinar actually just on lameness itself. But I'm hoping that that helped everyone out a little bit with regards to what I kind of look for when I'm assessing horses. So if I'm on the yard and just having a look either for a lameness point of view or anything else, they're the things that I'm paying attention to. So I'll basically leave it open. I'll open up the chat window. If anyone's got any questions, more than welcome to kind of throw them at me. Not a problem. But if not, what I'll do is I'll finish in a couple of minutes if no one's got any questions. And if you do give me a message, if you do want one on lameness, let me know. The one thing that I do need to also say is we do have an actual in-person client evening here at Church Farm in Albury on the 29th of April, 7 to 9, where Nikki's going to be basically going through everything to do with foaling, basically. And our new vet, Georgina, is also going to be doing everything with regards to preparation for foaling and immediate post-care. I'll also be doing a very short introduction prior to Nikki coming up in front of everyone on the Slape app. So one of the lameness apps that we've actually got, which can help do incredibly quick lameness kind of diagnoses and everything in the field for people. So if you are interested, please do come down and everything and show your support a little bit. I'd like to thank everyone really for basically coming online. I know I've gone on a little bit over. and all sorts. I'm going to have a little look. And there, yeah. So we've got one person for a lameness one. Got one question here. How do we find a good vet to do an assessment if not local enough for you to do it? So I think with regards to these ones, we all of us are on WhatsApp. There are various ways in which you can take video, and I'd like to do a lameness one because I get some videos which are really poorly taken, and it makes it harder to assess whether a horse is actually sound or not. You really have to see that horse perfectly straight behind, have the video zooming in and following it going forwards and having it coming back to you, also seeing it from the side as well. So I'll quite happily do a lameness one, and I'll show you some of the videos that I get when I'm asked to see if a horse is lame or not, compared to videos which are absolutely ideal. So it is all about having, yeah, the good images for us to also help you out on WhatsApp. Finding good vets though to do an assessment. Most of us here have come into contact with a lot of other practices in various areas. So getting in touch with the practice, do we have any personal recommendations or vets that we know in local areas and everything? We can definitely pass them on. The RCVS does have a really nice website with has a find a vet thingy on it as well. There aren't any other real ways apart from word of mouth to kind of find out, yeah, what vets are out there. So thank you to one person for asking that question, but I can put all of that basically into a lameness webinar if you'd like, and I can get that done pretty quickly. We can have another one in another 2-3 weeks if anyone's interested. So any other questions, or shall I probably let you all kind of go? Anything else coming through?
Ricky, can you hear me?
Oh yeah, hi, can hear. Yeah,
It's Carol.
hi, how are you?
I'm very well. Sorry, just to let you know, the chat wasn't working for me.
Okay.
So I don't know if but it sounds
Yeah.
like it has been for other people, so perhaps it's my end. But yeah, just thank you very much for doing this. It's been really useful.
Absolute pleasure. Say, I appreciate that it's hard for people to come down to client evenings in situ. People work long hours just like we all do. So I'm keen to do more things like this. But if I've set it up right, there will be a little questionnaire at the end to say about what kind of subjects you would want actually in in a webinar. I can do everything from lameness through to tumors, sarcoids, eyes, x-rays, you name it. I can go through whatever you like, really. We never tend to get a lot of feedback from people on what they want. So if you tell me, I can get a webinar done, get it constructed and stick it all online. We're recording all of these as well. So anyone can watch these at a later date. So, but no, thank you very much for being part and parcel of it. So it's a bit of an experiment for us and for me, but at least we've managed to get most of it out this evening, and not too many technical issues.
Yeah, no, I think it's been great.
Cool.
I mean, from my point of view, I'd love to dive into the topic of X-rays for purchase and what you shouldn't do. But perhaps you could cover that in a future one.
I could definitely do that one and everything. I think that's another good one because we do always get asked, "Oh, can you come out and take some vetting X-rays?" And like, what do you want me to start with? There's a lots of parts, so I can go through all the different projections, the different ones that are more pertinent to younger animals, and ones with regards to balance that you should probably avoid or at least get them to sort out before purchase. So yeah, we can go through all of that, and I've got loads of examples of X-rays that we've taken as pre-purchase exams, all been sent to me literally, and that via clients. I quite frequently get batches of 40 or 50 X-rays to look through all at one time. So yep, can do that, not a problem.
Great.
Well, cheers, Carol. Thank you very much. Well, thank you, everyone else. I'll leave you all in peace. And yeah, if you do have time, please hop onto our website and you can register for the Full Speed Ahead client talk that we got on the 29th. But yeah, everyone, have a good evening. Thank you very much again, and we'll see you all soon. Okay, bye-bye.